Inflammation. I don't really know what that word means. How would you summarize or simplify that word for anybody that also doesn't really understand the term inflammation?
Yeah, it is abstract. I think to your point, I use it so flippantly that I realize I'm in this weird health bubble, but it is a nebulous term. It's not inherently bad. It's a product of the immune system. The immune system makes different proteins, different amino acids, different chemical messengers, if you will, that fights viruses, fights bacteria, heals wounds. So when you think of inflammation in this sort of normal acute state, it's if somebody gets a sporting injury and their knee swells up, right? That's acute inflammation rushing nutrients and healing and oxygen and white blood cells to the area to repair it, to rejuvenate it. That's normal, measured human inflammation. We would be goners as a species without a normal inflammatory response. It's when inflammation goes chronic that there's a problem. Chronic inflammation, it's associated with just about every health problem under the sun. When you're looking at what researchers are looking at these inflammatory components, you're looking at autoimmune issues, metabolic issues like type 2 diabetes. When you look at cancer, heart disease, to mental health issues, as I mentioned, this sort of cytokine, looking at the neuroinflammatory component to things like anxiety and depression. So that's what inflammation is. When it goes chronic, it really sets off a lot of cascade of dysregulation in the body because it's a lack of homeostasis. It's the Goldilocks principle. It's not too high, not too low, but just right. That's where you want inflammation, just like many things in the body, just like the gut bacteria in our microbiome. We don't want bacterial overgrowth. We don't want a deficit of beneficial bacteria. Like hormones, we don't want too much hormones, like a dominance of hormones. We don't want a deficiency of hormones either. Inflammation is the same thing. We don't want excess inflammation. That's what's associated with all of these chronic health problems. And we don't want a deficiency. That's immunosuppressed people, that people have immunodeficiencies. That's not good either. So it's about modulating and supporting healthy inflammatory pathways is really the clinical objective for my patients and for the average person out there that's looking to optimize how they want to feel. That should be their goal as well.
So I've got two questions there. What is a symptom that one might notice in themselves of chronic inflammation, and what are, in your practice, what are the leading sort of causes of that chronic inflammation?
Sure. So the way that we see it in functional medicine, there's three main stages, if you will, on this continuum, this inflammation spectrum. On one end, there's silent inflammation, silent autoimmunity, meaning if you ran labs, you'd see some markers off, like a high sensitivity C-reactive protein, which is quite a conventional marker. You'd see that spiked. You see maybe a homocysteine level elevated in another inflammatory protein, but the person feels all right. They say everything's cool. Stage 2 is the inflammation reactivity. That's the vast majority of people living on our planet today are in stage 2 or 3. Stage 2, a lot of people are there. They have things like brain fog. They have things like fatigue. They have some sort of dysregulated nervous system response, a way that people typically will say it. They'll say, I'm anxious, but I'm exhausted, or wired and tired is the other way of putting it. They have different digestive problems. I mean, the amount of people that have chronic constipation or IBS or some sort of digestive issue that, again, they're everyday, so they normalize it. But these things are anything but normal. They're just ubiquitous. And I would put under that category mental health issues, like anxiety and depression, autoimmune reactivity issues, and people that have hormonal problems. And then stage 3 is a full-blown diagnosable issue. Like they're going to their doctor and they're given an ICD-10 code in the States. They're given some diagnostic code and they're given a medication or recommended some conventional treatment. But researchers estimate it's about 4 to 10 years prior to that diagnosis when things were brewing on the spectrum, meaning by the time somebody gets diagnosed officially, it didn't happen overnight for most people. So it's no matter where you're at, how can you be supporting your gut and your feelings? How can you be supporting your physical health and your mental, emotional, spiritual health? So to answer the second part of your question is like, what are the most common causes of it? It really stems, like the broad umbrella of it has to do with what researchers refer to as an evolutionary mismatch or an epigenetic genetic mismatch. Our genetics, it's estimated, haven't changed in about 10,000 years. But yet our world has changed dramatically in a really finite period of time when you're putting that into context with the totality of human history. So the foods we're eating or the foods we're not eating, our stress levels, our collective and personal traumas, environmental toxins, our soil microbiome disruption and depletion, and in turn impacting our gut microbiome. So all of these epigenetic modulators, if you will, our DNA is living in this brave new world, and it's awakening genetic predispositions that have been lying dormant there for 10,000 years, but they're being triggered like never before in human history because of this onslaught of this chasm between our DNA and the world around us.
So on that point then, the world we live in is maybe misaligned to our genetics, which is kind of what I heard there. Let's start with the emotional stuff. One of the topics you introduce in chapter 1 of your book is this idea of shameflation. Never heard that term before.
Yeah. Shameflammation.
Shameflammation. What does that mean? And what science have you got to support that that's a real thing?
Yeah, well, it's really a commentary on inflammation. It's not that shameflammation is a literal real thing. It's a commentary on how does what's shown in the research as far as in things like chronic stress, which is so well researched, and trauma. And I talk about in the book something called intergenerational or transgenerational trauma. How do these things impact our body, our physical health? So shame is sort of a term that a lot of my patients feel varying degrees of shame. They feel shame that they're not perfect enough with their body or around food or around life itself, not being the best parent or the best whatever in their life. There's a lot of health-related shame in our world and just shame in general when it comes to life. So shame is sort of the term that I used in the book of how to explain the sort of mental, emotional, spiritual feeling that people have, how it is impacting their health. In the book, I talk about this study around self-compassion, which is really the antithesis of someone that's shaming themselves. It is someone that has sort of grace and a lightness and a self-compassion around it. And the study had they had them speak in public or do math, which apparently that's what we hate the most as humans. But they measured their inflammation levels when they were doing these stressful things, right? And their inflammation levels were high. Interleukin-6 is IL-6 inflammatory protein. But the people that practiced self-compassion during this time had the lowest levels of inflammation. And on day 2, you'd expect, the person would sort of adapt, and the people that were doing the math or the public speaking, maybe the inflammation would come down. Actually, the inflammation levels were higher on day 2 than day 1, sort of this cumulative effect. But again, the people that practice self-compassion, which I talked about the different practices in the book that I've seen effective for my patients, it attenuates, calms that inflammatory response. And that's just one of many. But we know most health problems of why people are visiting their doctor are stress related, that are either exacerbated by stress, that are flared up by stress, or literally caused by stress. When you're looking at things like autoimmune issues, we have patients fill out what's called an adverse childhood experience score, every telehealth patient that we have. And research has shown that people that have these higher ACE scores, these cumulative childhood and beyond childhood lifestyle, like life stressors, whether physical abuse, sexual abuse, mental emotional abuse, alcohol abuse in the home growing up, people that have gone through these things in life have an increased likelihood of an autoimmune issue later on in life, or a mental health issue later on in life, or a metabolic like type 2 diabetes issue later on in life. So again, there's a lot of shame around that stuff too, as far as what people have gone through. So shameflammation is really just my term to explain this phenomenon that's in the scientific literature that I see play out in people's lives on a daily basis.
You talked about how vicious stress is as a cause, I guess, for inflammation. People tend to think of stress as being a really, really bad thing. I hear often that some kind of stress is a good stress. What is in particular the type of stress you're talking about that is leading to this shameflammation? I'm assuming it's chronic stress.
Mm-hmm. Yeah, the human species wouldn't be here without some grit and resilience. And I think in some ways you could argue that we're really lacking a resilience and grit. And that's something that I'm teaching my patients and in the book, for people to sort of gain a resilience to handle stress. There's nothing wrong inherently with stress. And even if you look at the research around hormetic effects or hormesis, like people are doing the cold plunges you see all around the wellness space, or sauna therapy, or high intensity interval training, or even things like fasting. These are all hormetic effects that humans would have spent times in, like difficult times, periodic times of stress. That actually makes our cells more resilient and our souls more resilient in many ways. But it's the chronic stress where it's out of alignment with that ancestral health perspective. There's that evolutionary mismatch that I mentioned earlier. That is something that we haven't aligned with. We have these different stress adaptation responses in the body, and the body's releasing things like cortisol and adrenaline, and we never allow this sympathetic fight or flight stress aspect of our autonomic nervous system to calm down. So we're always in this fight or flight stressed state to varying degrees, that people never are able to regulate themselves and never able to support that parasympathetic, that resting, digesting, that hormone balanced state of their nervous system. So yeah, it could look different for different people, but the things that I hear the most from people, it's their jobs. It's like a lack of, I would say, healthy boundaries with their jobs, and their family can be a source of stressor. Finances can be a sort of stress, and their health. I think when you don't feel well, that's stressful as well. Those are the most common things that I hear from people.
This fight or flight response, this sort of prolonged state of feeling like you're kind of in fight or flight, which is sort of characterized by being short of breath or feeling a bit on edge or nervous. What is the consequence of being in that state for too long? Because a lot of people can probably relate to that.
Yeah. Well, that is in part what's driving these vast epidemic of health problems in our world today. When you're talking about 50 million Americans having an autoimmune condition, hundreds of millions worldwide are having autoimmune condition, type 2 diabetes. I mean, it's the vast majority of people in the West are somewhere on this insulin resistant spectrum, meaning they have things like PCOS or weight loss resistance or insatiable cravings or prediabetes or type 2 diabetes. All of these health problems that we are plagued with as a world are in part fed by chronic stress. It's just a matter of how much your body can handle. And that's sort of the conversation in the book about bioindividuality, right? Some people have the analogies, sort of that bucket analogy. Some people have massive buckets and they can handle a lot of things in their life before it's going to hit that tipping point.
What is the tipping point?
The tipping point is health problems, where something's got to give and they realize they're diagnosed with a health problem, and it's stressors, the foods we eat, trauma, all of these things accumulate. You can't change your bucket size, but you can change what you put in it. You can't change your genetic tolerance for stressors, but you can change what you put in it. So it's really a message of agency, right? It's a message of, what can I do? We all have different abilities or thresholds to handle things in our life, but we all have the ability to clear these things out and to heal ultimately.